to the Offshoot. I'm the host, Lee Sean Nelson. Today, I have a very, very special guest, Dr. Okey Enyia, who is a professional when it comes to healthcare. He has worked in the healthcare industry regarding in DC government. He also has worked with the federal government in terms of healthcare at the National Institute of Health, and he has his own consulting firm. Today, we want to talk about Black men in the healthcare. And so we have a few questions about what's going on. Are Black men getting enough healthcare? Are they seeking healthcare? Are they aware of what is out there in terms of healthcare? Uh, Dr. Okey Enyia, how are you doing today?
I'm doing very well. Thank you so much for having me.
So thank you. I'm very, very humbled to have you for these few minutes and to discuss the state of affairs when it comes to Black men in healthcare. Um, what did I miss about your background? What can you add that give people some gravitas about your expertise and why you are an expert when it comes to healthcare, and particularly when it comes to Black men?
Sure. So I'm a former House and Senate staffer on Capitol Hill. And then after my time on the Hill, I went to do some work at the Department of Health and Human Services. After my stint there, I went to DC government. And then I'm currently working in the not-for-profit space. My current role, I serve as a lobbyist on Capitol Hill. So it's been a full circle season for me. And then my doctoral work, I have a doctorate in health policy from GW here in DC, and my doctoral studies work rather was the first of its kind to examine the Affordable Care Act and its impact on access to care for Black men compared to white men. And my study found that while the ACA did uh, increase the proportions of insured men by close to 50%, it did not improve access to care for men. When that data is disaggregated across race, um, Black men were 30% less likely to have um, insurance, and they were 25% less likely to have access to care compared to white men. So there are clear disparities, clear inequities that are inherent in the current healthcare system. And part of the reason why I chose to focus on Black men in my study was because historically Black men are invisible on policy and research agendas. Um, at the same time, we are hyper visible when it comes to criminal justice
Yes.
reform, right? And so, um, you know, I wanted to make sure that the voices of Black men were amplified. And part of how I'm carrying this work forward is in the run up to the 2024 presidential elections, Vice President Harris proposed an opportunity agenda for Black men. And about 3 or 4 days later, I did a brain dump and I drafted what I'm framing as
Mhm.
a John Henry Health Equity Playbook, a 4-year health policy agenda for Black men. And part of the goal or the aim was to help to support the Harris administration as it relates to the health and well-being of Black men and boys. And so, and I also said that in that time frame between October and November, I said that whether she wins or not, part of my goal is to continue the work
Yeah.
of amplifying the unique needs of Black men. And so now I am looking to galvanize key stakeholders to help to shape this playbook because, of course, I'm also thinking about midterms in
Mhm.
2026. And I want to make sure that as things evolve in the coming years, that there are ways in which I can help to shape federal, state, and local policy on behalf of Black men and boys.
Yeah. So you clearly have a holistic perspective when it comes to healthcare. And it's quite curious that despite the success of the Affordable Care Act, or as some people know it as Obamacare, more people did sign up for healthcare, more white men and more Black men, but still there was that disparity.
Hmm.
And can you go into a little more detail as to what you found in your research
Sure.
regarding that disparity?
Yeah. So, put very plainly, I would argue that it is structural racism. It is anti-Black gendered racism. The barriers that Black men have to face, that have to navigate when it comes to engaging with the healthcare system, that has been indisputably, found for decades. Uh, in fact, in my doctoral work, I traced the history of the healthcare financing system, and you know, when you do that, you find so there's one common thread is uh, the extent to which Black people in general and Black men in particular are we seen and treated as human beings first? Um, are we valued as Black people? Are we valued as Black men? Um, have we been part of the policymaking process? And so, because those who have been in power have the ability to draft policy, it is uh, this country is rooted um, in the the disintegration of the African family or the Black family,
Mhm.
and over the course of our nation's history, the various pieces of legislation that have been drafted and enacted into law have created the system that we see today. They have created the disparities that we see today. They have created the inequities that we see today. The disparate uh, health outcomes in terms of heart health, in terms of prostate cancer. Black men are
Yeah,
twice as likely to get prostate cancer than white men. Black men have the shortest life expectancy than almost any other racial and ethnic group in the U.S. Um, and so, all of those things uh, shape outcomes. Black researchers
mhm,
are 40% less likely to be funded by federal agencies. Black researchers who have a vested interest in doing research on behalf of Black people are less likely, right, to get uh, funding support to help to build out the evidence base um, that helps to create targeted interventions that can hopefully help to improve health outcomes. And so um, there's a plethora of barriers, issues, policies, practices that are agnostic of the Black male voice in measurable, meaningful ways. And so if you're not at the table, you're on the menu.
mm,
And so because historically Black and brown people or Black men have not been part and parcel of the policymaking process in meaningful ways, you're going to continue to have the outcomes that we see.
yeah. Well, so then you must be very concerned then about what's going to happen over the next 2 years, or what could possibly happen over the next 2 years, because we have an administration coming in, a new one, that plans to basically make government smaller, whatever
Hmm.
that means. So we have to assume that it might include things like NIH or other healthcare organizations. We know that's going to include things like the Department of Education. So what concerns or worries do you have over the next 2 years that if what the new administration is planning includes making government smaller, which involves healthcare.
Sure. So, like many others, I have read through Project 2025.
Okay.
And
Brave man, you are.
and the 900-page document, it is um a clear effort to um dismantle, dismiss, um disintegrate the social net, the social fabric, the social systems, supports, and services that historically supports not just Black and brown people, but also white people and other people from different races and ethnicities.
Hmm.
And so, yes, typically when a Republican administration comes into office, they are much more conservative. They want to shrink government. They want to deregulate uh, policy. Um, in fact, just one example is this effort to reform the National Institutes of Health and taking the 27 um, divisions
Yeah,
and shrinking those down to uh, about 15 or so. Um, and
that's a lot of people, a lot of employees.
Yes, yes, and so it will obviously have devastating if it happens to happen. It would obviously have very a very devastating impacts and effects on a lot of different things in the scientific community, as well. Of course, that'll trickle into other ecosystems. Patients, insured, like it's just so it's all connected, and so. Um, part of the part of the strategy, given um, what is ahead over the next few years, is to take a protective stance of our issues, but also explore ways in which those that lean left can potentially work with those that lean right. And there are ways to do that. Like that is possible. That's not anything new. But I think it uh, we have to play the long game, and I've been someone who um, is very interested in exploring how to work closely with um, any areas, any folks that have interest in the work that I've done,
Hmm.
but also planning ahead to ensure that when the pendulum swings back to the left, that there has been enough work that has been done and operationalized so that it's an easier lift to stand up more health equity related programs and efforts and initiatives. And so that is part of the goal.
So it sounds like, if I'm hearing you correctly, that you believe that there should be a pragmatic approach, um, and that's something that should be long term. But what about the individuals? What can people do to ensure that um, there could be a pragmatic approach when it comes to healthcare, particularly for Black men, when you think about what you said earlier, Black men are not uh, signing up for healthcare.
Mhm,
They are not getting the routine exams that they need to ensure that they don't get prostate cancer or
mhm,
die at an earlier age. Uh,
mhm.
so, is it a lack of education? Do we need to start there, or where do we need to start?
Yeah, that's a great question. So partly it is an education issue. In fact, so in my study, the infrastructure is in place to help raise awareness about the importance of seeking help. Historically, Black men have had to navigate barriers when it comes to help seeking, right? We so there is an element to manhood or masculinity that I think can get in the way of us being willing to seek help.
That sounds like
Um,
pride.
yes, right. Pride, ego, right? And then there's fear and mistrust and or distrust of of the healthcare system. Um, we're and then also you have the spiritual component where some people, their bent is towards praying about it, right?
Hmm.
Which is valid and that's fine. At the same time, uh, there are professionals and different ecosystems that are trained or should be well trained to support you, whether that's physically or mentally or um, or or emotionally. And so um, I it's about meeting people where they are. So where are the Black men? Where do we tend to congregate? Where do we tend to feel safe? Right. So is it the barbershops? Is it the car shows? Is it sporting events? Is it the churches, mosques? Um, uh, it, you know, and or are um, do people in power and who have access to resources, do they see the value in investing in sending support, sending out,
Hmm.
mobile units,
Yeah.
sending out um, staff to different parts of the community uh, to to reach people where they are. Yes, we can put on health fairs and town halls and all of these things.
Hmm.
But the infrastructure, I would argue, is in place. I think it's part of it is one, someone doing the work to find the data to make a case for why we want to include Black men
Yeah.
in terms of policy decisions. Um, and two, it's it's ensuring that those that who have the privilege of having access to care, can serve as mentors,
Hmm.
um, can serve as liaisons to those within their family to help to facilitate the help seeking
Hmm.
that is available. But then you also have the physician shortages. 6% of the U.S. physician workforce are Black. 6%. 3% of the physician workforce are Black men. And
It's
Black
very
people
hard
make
to
up
say for the number of Black men in the country.
exactly. Black people, make up 13% of the U.S. population, and the disparities there. So it's always a multi-factor, multi-level, thing when it comes to how do we collect the highest quality disaggregated data to help to make the case for why we want to allocate sustainable funding to certain places to better support Black men in terms of their health and well-being.
It sounds like a very big and daunting task. And I say that because one of my brothers, this was a few months ago, in late October, he had been having some abdominal pain. And again, he's in his 40s. And he had been having this pain for some months, almost a year. And it finally got to the point where he went to the hospital and they had to keep him overnight. And so I'm talking to my mother and talking to him. I'm like, what are you doing? Why haven't you have yourself checked out? And I
Mhm.
said to him, I said, it's probably some kind of stone. Uh, and I'm asking him what is he eating.
Hmm.
He doesn't drink, and all that. So to make a long story short, uh, he was reluctant to have surgery to have the stone removed. It wasn't until two women came in and prayed
Hmm.
over him, and one of them telling him that she went through the same process, the same
Hmm.
surgery. Only then he decided, okay, I'm going to do it. And he thought about it, and he was telling me that he wanted to be there for his youngest daughter,
Hmm.
okay, my niece. And so I was like, well, I'm glad you did that, but you got to start taking care of yourself. You can't wait to the last minute. You can't wait for a whole year being in pain and then decide to do something, and then you're going to pray about it. I said, prayer, like you said, is good, but uh, but you also need a physician.
That's
So
right.
how do we overcome that?
Yeah.
Because I think it's more common than we realize.
Hmm. I've heard a lot of stories. I have conversations all the time with other Black men in different groups where, either they're so again, it speaks to the broader vestiges of racism that have impacted and shaped and caused trauma, um, to the point where we are very distrustful of the healthcare delivery system. And rightfully so. You have Tuskegee, right?
Mhm.
You have other other experiments and experiences that have exploited black and brown people. You have Henrietta Lacks, at Hopkins in Baltimore, where um, doctors took um, um, Henrietta's
Yeah,
cells
yeah,
and
yeah,
found that
yeah. Hmm.
like this is a gold mine in terms of you know treatment, um, but the system exploited her cells, and even to this day, there's still some battles going on with that piece. But
Financially, particularly.
right, and so, but yes, studies have found that married men um, tend to have better health outcomes because they have a spouse who is the one that kind of takes over his
Yeah,
health care.
healthcare.
She will schedule the appointments and she'll drive him to the doctor, right? So it's that support that also makes a difference. And so, to your point, that patient, he had people in his life uh whereby he could receive that type of support and encouragement to be able to follow through with what was needed to get him better.
Yeah.
Yeah.
It's still incredible and kind of sad. And so with your work, uh,
Hmm.
you're hoping to mitigate a lot of this, and particularly over the next 2 years. Um, you mentioned also that, at the midterm elections in 2026, going to 2027, you're hoping, and I'm hoping as well, that we will see a change in the House and in
Hmm.
Congress, both sides of the House, in the Senate and
Hmm.
the House side. Um, but that's still 2 years.
Yes.
We have to wait till we get to that point, and that's still no guarantee. But with your work, um, what is the strategy? What can people do to support you between now and the midterm elections?
Sure. So June is Men's Health Month, and so part of my goal is to galvanize some key stakeholders to help shape this playbook so that we can identify some specific content or elements of the playbook that can be operationalized over the next several months. And so, um, what 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 content from the playbook makes the most sense to use as an education campaign for Men's Health Month? Um, what's committees, task force, coalitions are in place, or that can be created to think through various elements of the playbook and explore how it can help to raise awareness about certain issues. And so those are things that I'm thinking about, that I'm planning for.
Mhm.
Um, and again, I would look forward to working at the local, state, and federal levels, on this to be able to build a movement
Yeah.
that is sustainable and meaningful.
Dr. India, thank you so much for this time.
Thank you so much for having me.
And so where can people find you?
Yeah, so you can find me on all social media with my name, Okey Enyia. I'm on LinkedIn, Facebook. My IG handle is Enyia Strategies, so it's ENYIA Strategies. That's also my website. You can find me on YouTube as well. And so, yeah, I'm pretty accessible. Folks can feel free to drop me a message, and we'll go from there.
Thank you. And thanks to everyone for listening to this episode of the Offshoot Podcast. You can find us on all streaming platforms, including Spotify, Amazon, and iHeart and Apple. Thank you. And thank you again.
Thank you so much.
Thank you for listening to this episode of the Offshoot. Please like and subscribe to this channel wherever you get your podcasts, iTunes, Spotify. Thank you.